All right, so welcome to our webinar. We are in the Trans Healthcare 101 series that we, as the Transgender HIV Prevention Task Force, are doing as a series. Our webinar for today is specifically resources for under and uninsured folks. Just as a note, this is being recorded on November 3rd. So there are definitely some parts of this where things might change by the time that this is being publicly displayed. I'm going to state that up front. So hello to future us. Cool. Okay, so click. So we are.
Hey y'all, I'm Sean Riley and I use they, them, theirs pronouns.
And I'm Jack Marr. I also use they, them, theirs pronouns. So we will be splitting this up into two halves. I'm going to take the first half. In our agenda for today, we're going to talk about a couple different things. There's a big agenda here. So the first thing that we're going to start with is some general patient rights and protections. We're going to talk about medical debt and resources for people who are uninsured. And then Sean is going to talk about healthcare for people living with or at risk of acquiring HIV, and then also PrEP, which if you don't know what that is, we will talk about it. Okay. So first thing, general rights and protections. So the first thing that I'm going to talk about is federal protections. So the main thing, if people aren't aware, is the Patient Protection and Affordability Act. It's usually called the ACA or it's called Obamacare. Most people refer to it as the Affordable Care Act, but the entire title is Patient Protection and Affordable Care Act. And I personally think that the most important part of that legislation was the patient protection part. So some of the things that that specific piece of legislation guaranteed is that you can't lose your healthcare coverage because of a pre-existing condition or diagnosis. That would include things like being diagnosed with HIV. There is zero cost preventative care that is specifically for folks who have like a public health insurance program or a public health plan. But a lot of other people with health insurance that's private might still see that there's like zero cost preventative care, which would include things like vaccines or birth control or things of that nature. It also put no lifetime limits on care. So your health insurance can't essentially tell you that, you know, they've covered you as much as they're ever going to cover you. And from now on, you know, you're on your own. That is gotten rid of by the ACA. And then specifically, there is a section called Section 1557. It's a little up in the air right now. Initially, it was written to end discrimination based on sex, gender identity, or sexual orientation. So initially that included sex discrimination, including termination of pregnancy or abortion, and gender identity, which was defined as one's internal sense of gender. And then the Trump administration happened. There were some changes to how this rule was being applied. Essentially, it is now being applied as like just sex, which in their definition is the plain meaning of the word sex as male and female and as determined by biology, which we know. They're still technically including birth control in this ruling, but the initial protections that this rule was meant to have isn't currently how it's being enforced. That might change in the future. But that's good to know that there were at least attempts and there might be a future change in how this rule is being enforced. Also, the right to privacy. So most people know HIPAA, but there is some confusion about like what it means. Essentially, it just means that your medical provider and insurance cannot disclose your information without your consent, just as a general rule. And then one other thing, I didn't include state. We're in Tennessee. There's not a lot of like state protections specifically for patients. But there recently, this summer, because of COVID-19, there was something that was put into place for telehealth protections. So essentially saying that like, um, if you are using telehealth because of the pandemic or for any reason really, you get the same protections as in-person care. So you should expect the exact same things regarding privacy that you would expect if you went into your doctor physically as you would if you're doing a telehealth session. And then some general protections and rights. So I kind of wanted to cover this just because I don't think that most people like know that these are things that are supposed to be protected. These are not guarantees. These are mostly like things that are supposed to be afforded to you. So if you go to things like the American Medical Association or the American Hospital Association, they will have things called patient bills of rights. And it's semi-vague language, but they say that what they're supposed to be guaranteeing people is rights to things like courtesy, respect, dignity, timely response, the right to receive information from your doctors, the opportunity to discuss the risks, benefits, and costs of treatments and alternatives, the right to accept or refuse any medical treatment, the right to obtain copies or summaries of your medical record. And then most importantly, I would think the right to be given sufficient notice and reasonable assistance in making alternative arrangements. So specifically when it comes to stuff like, the courts have upheld in recent years that if providers have, quote, strongly held religious beliefs, they can refuse to serve certain people, including transgender people. But the law as it currently stands and these like patient bill of rights is that while they can do that, what they are supposed to do is essentially provide you to give you to another provider who can provide unbiased care. They're not just supposed to say, we can't serve you and we're not going to help. They're supposed to say like, I'm not going to take care of you, but here is a provider who is going to do what you need them to do, which is what is supposed to happen. So it's not great, but knowing that, if someone's saying that they won't do X, Y, and Z for you, they're supposed to find you someone else to do that in a timely manner. Again, not a guarantee, but useful knowledge in your back pocket. Okay. So medical debt, this is a very high level overview, but given these couple facts, having some base level knowledge is great. So millions of Americans have some form of medical debt. This has only gotten worse since the COVID-19 pandemic. But in 2016, Tennessee had the 10th highest rate of medical debt in the country. That was approximately 1 out of 4 people had some sort of medical debt on their credit report. That's how this fact came about. They checked people's credit reports, and the median amount of medical debt was $739. And again, that was 1 out of 4 Tennesseans. And then if you look at this is just looking specifically county by county. It goes anywhere from 10% in Williamson County all the way up to 43% in Lake County, which is the dark red in the northwest corner of Tennessee. So varies by county to county, but a good percentage of people wherever you are have some form of medical debt. Obviously a common problem. It's not talked about a lot. So like, what are you supposed to do about this? So before you have medical debt, if at all possible, some things to do are mostly planning ahead. So shopping around, like I said before, you are supposed to be given the right to, refuse medical services if you don't want to talk to more than one provider. So if you know that you are, say, getting surgery, you have the ability to call around to different providers and ask them what certain costs are. You have the ability to check with your insurance and like get information from them. You might be able to check your insurance website to see what certain things will cost based on the provider that you go to. So just shop around. You don't need to go to the first person and do exactly what they say and not ask any questions and not get a second opinion. You can also negotiate the cost or a payment plan. This comes with like a big asterisk, but you know, it's worth trying. Of like, if you need something and it costs a lot and you're not going to be able to pay for it, you can ask to negotiate the cost. A lot of providers are willing to do a payment plan, especially for something like surgery, where they will at least try to work out a plan to make it more easily payable as opposed to like a giant lump sum. If your health insurance, if part of the reason why you're incurring medical debt is because your health insurance is denying you coverage of something, and this is specifically related to like trans care, one thing to check is why the service is being denied. So if they're denying you care and charging you, $2,000 because you're a trans man and you got a pap smear, and they're saying, hey, men can't get pap smears, which is obviously incorrect, but that's the reason why they're saying that they're not going to cover it, is because you're a man and that means you can't get a pap smear. You can work with your provider to correct/justify this claim, because they should be covering that if you have the right body part for that procedure. But like that might be the reason why they're denying it. So work with them. And then if a service is deemed cosmetic, or it's like quote unquote not medically necessary, this one's a little bit trickier, but there are some ways, like usually the insurance will just like deny it, and like you should have some ability to go back and try and say like, no, but actually this is medically necessary if that's the reason why they denied it. So I would recommend this website, transhealthproject.org. It's a great website. It's got a lot of nitty gritty about different plans and different services, and like what you might need to do on your end to justify that something is quote unquote medically necessary for your insurance to cover it. That doesn't guarantee that things will be covered, as I have personally experienced, but good to know if this is something you're wading into and you don't really know how to do anything with this. And then after, so if you already have medical debt, again, negotiating cost or a payment plan, it's better to do it before, but you can do it after you already have it. Providers are, they'd rather get something than nothing, is the long and short of it. So if you can work with them, that's great. I will say get it in writing, because the last thing you want is to negotiate a plan and then, they come back 6 months later and say, you know what, actually, we want the full plan, or we want the full payment and not what you negotiated with us. So if you have anything like that, get it in writing. Medical debt will eventually go to collectors. But essentially there's a time limit. So in Tennessee, the statute of limitations for unpaid medical bills is 6 years. So that just means that like, if you had a medical procedure done and you had some leftover payment from that, and 6 years go by and suddenly a collector's on your door for the very first time, it essentially just means that like they will have a harder time in court justifying why now they are coming to you for this medical bill. It doesn't guarantee that you won't have to pay it. It just does mean that they're going to have a harder time arguing for why you need to pay it all these years later. Medical debt does affect your credit score. It affects it a little bit differently than a lot of other stuff affects your credit score. So it's given less weight. It does go away immediately after you pay it off. So some things will stick around on your credit score even after you've paid them off. Medical debt will go away the moment you pay it off. So it's a little bit different, but it still does affect your credit score. And then anytime you are contacted by a collection agency for medical debt, first of all, make sure it's not a scam. Second of all, you have the right to a written confirmation of the debt as well as the right to dispute it. Again, that might involve going to court, but like technically you have the right to dispute it, and definitely get things in writing. Don't just take somebody on the phone for their word. I would also say if you have people calling you for medical debt and you've never checked out the Fair Debt Collection Practices Act, that is an act specifically regarding medical debt and your rights. And if you've never seen that before, I would suggest checking that out to at least know what rights you are guaranteed, what protections you have. We know as trans people that like, just because I have a right doesn't mean that I'm going to be protected actually, but it's something. And then one last thing about medical debt, it is different than say like a mortgage, right? Because if you default on a mortgage, they will take your home away. They can't take back medical procedures that they give you, obviously, but they can do things like garnish wages, or request liens to be put on any property. So just keep that in mind of like, obviously they can't take back what they gave you, but they can do other things to get their money. So, resources for under and uninsured folks. So again, a quick overview, because this is a lot of material, but just some things to keep in mind if you have absolutely no idea about any of this and it's the very first time that maybe you're in this situation or you've just never been communicated any of this knowledge. So approximately 27 million Americans didn't have insurance in, what is this, 2018. Oh, sorry. So that has increased, but just to say that a lot of people don't have insurance in this country. It's not uncommon. So some things that I would say, if you're underinsured, which means that you have insurance, but it doesn't cover everything you need it to cover and you're still paying for medical costs, or if you're uninsured, you don't have any insurance. Utilize state and federal programs for free screenings. And that can be as simple as just like Googling free health screenings, Tennessee. You can apply for state or county medical assistance programs. These might be sliding scale or no cost. So some examples include the Tennessee Technology Access Program or Vaccines for Children program. Children specifically get a lot of extra like programs and coverage. So if you have children, know that they are given a lot more than you as an adult are given. So like, just because you might not be able to find care, children are usually easier to find care for if you are uninsured, or get them health insurance. You can use free clinics, again, for like preventative stuff, routine or primary care. This can be anything like private companies like CVS, or your local health department. I would highly suggest people check out their local public health department. If they have like absolutely no idea what they provide, they will often provide a lot of stuff free or sliding scale. And then also community-based organizations. If you have a chronic or severe disease, you can check with your closest university or teaching hospital to find out what they offer. Specifically in the Middle Tennessee region, Meharry is like the public hospital around here, and they have a couple of programs for folks who have more serious conditions and you're not just looking for routine care. Again, retail clinics like CVS, and then also prescription drug programs or coupons. I know we all see the GoodRx commercials all the time, but do check those out. You know, the pharmacies will also have programs, things of that nature. And then again, shopping around of like, you do have the ability to shop around. You can ask pharmacists if they have a generic of the prescription that you're getting, things of that nature. You know, don't, if you're startled by just like the sheer cost of something, don't let that scare you into just going, okay, yes, okay. You can ask questions and ask for alternatives and things of that nature, you know, when you have the ability. And then one thing I will plug is we, as the Transgender HIV Prevention Task Force, put together a transgender health resource guide. It is located here at hivtn.net/TTF. So that has a ton of providers that we have vetted, specifically focused on trans health. And then the last thing that I will share is right now is open enrollment. Open enrollment for health insurance programs. It lasts until December 15th. So if you haven't, please go check this out. To enroll in like a health exchange program that was created by the ACA, you can go to healthcare.gov to enroll. And if you're trying to enroll in something like Medicaid, which for Tennessee is the TennCare, you can go to either the healthcare.gov, you can do it that way as well, or tenncareconnect.tn.gov. Healthcare.gov is also the way that you would enroll a child in CHIP, which is the Children's Health Insurance Program. So again, if you've got like a child that doesn't have health insurance because you don't have health insurance, you can get them specifically enrolled in some form of public health insurance program through healthcare.gov. So go check that out. If you have absolutely nothing else, just go there and see what you can find. It's not a guarantee, but it's something. All right, Sean.
Sweet. Hey, y'all. Thank you, Jack. We would like to take some time to explore the options available to us as Tennesseans living with HIV, or those of us that are vulnerable to HIV. And to start us off, we're going to talk about the Ryan White HIV/AIDS program. So the Ryan White HIV/AIDS program was first instituted in 1990. It continues to be the largest federally funded program supporting people living with HIV in the United States. More than half of people diagnosed with HIV in the US use this program, which includes over 8,700 people within Tennessee, or roughly 49% of people living with HIV in Tennessee. You can hit the next slide. Sweet. So the Ryan White's program main objective is to provide ARVs and other HIV medication to the Ryan White clients to ensure their viral suppression. Viral suppression just means that a person living with HIV has less than 200 copies of HIV per milliliter of blood. And so they do this, the Ryan White's program. The Ryan White program does this through the AIDS Drug Assistance Program, which we will look at in the next slide. Sweet. So ADAP, the AIDS Drugs Assistance Program, helps Ryan White's clients gain health insurance through the Insurance Assistance Program, AIP, that provides Affordable Care Act or Patient Protection Act approved private health insurance plans, which can be used to access healthcare and protections for both ARVs and other HIV medications. Please note that the Ryan White program pays for health insurance premiums, prescription costs, and out-of-pocket deductible costs for Ryan White's clients that are enrolled within this program, the IIP. Or ADAP can also help uninsured clients gain ARVs and HIV medication through the HIV Drug Assistance Program, HDAP, which provides prescription ARVs and HDAP drugs to clients via a mail order pharmacy. So the HDAP program also covers limited outpatient primary care services at selected health centers in the state. As a general policy, the Ryan White program prefers to insure a client through IIP before allowing a client to be uninsured and access their ARVs and HIV medication via HDAP. So they're going to figure out, and we'll talk about this a little bit later, but when you work with a medical case manager to figure out which programs work best for you out of these and more. So next slide, please. So the Ryan White program also provides services to help ensure that clients remain in medical care and continue to have access consistently to their ARVs and HIV medications. And so some of these services we listed out here, but these are not limited to these, right? So there's other services that might be available, but these are some that can provide an example. So medical case management, we'll talk about this more in a minute, but having access to a health provider that can help manage a Ryan White's client care, mental health services, outpatient substance abuse assistance, transportation to access medical appointments, food support. This is a limited amount of assistance per month, but it does exist. limited housing support as well, and emergency financial assistance, EFA, which helps to cover emergency financial situations related to rent and mortgage costs. Sweet. Next slide, please. So in order to be eligible, you in Tennessee for the program, you must be diagnosed with HIV or AIDS, and you must have proof of diagnosis, be a resident of Tennessee, and have a household income that is less than or equal to 400% of the current federal poverty level. So if you look at this nifty chart that we provided you here, you could see if there's one person living in your house, if you live alone, that number is $51,040. So if you make less than $51,040 or up to $51,040, you can qualify for this program. For another example, if there's 4 people in your household, if altogether you make less than or equal to $103,000, you can be access this program. You also have to not have access to or otherwise be ineligible for other healthcare insurance through employment, Medicaid, Medicare, the VA, etc. The Ryan White program is required to be the payer of last resort. So they can only provide assistance to eligible clients that don't have access to health insurance, like I said. So they kind of cover the gaps of what other folks aren't able to pick up. You can hit the next slide, please, Jack. So if you meet all of these eligibility requirements, you must see a medical case manager in order to enroll in the Ryan White program. So you can find a medical case manager right here at this website, bit.ly/medical case manager. And medical case managers will make sure that you're eligible for the program, and they can help you in enrollment in the program. They will ask you to show documentation to prove your HIV diagnosis, which might be something that includes like a letter from a physician or lab results, your identity and proof of Tennessee state residency. So this could be a driver's license or a library card if it has a photo on it, and provide proof of income. Once you're part of the program, your medical case manager will help you and follow you throughout your care, and recertify you 2 times a year, so every 6 months, to ensure that you continue to be eligible for the program and you can continue to get benefits. There are other services as well, but you can find out more about the Plan B program here at this website at the bottom, bit.ly/Ryan White Plan B. I also just want to make a note that the Ryan White program website that we have is currently being updated, and really soon we should have lots of new content, which include updated list of providers, information on where clients can receive services, and the locations of where the services are available. Sweet. So what about people who don't have HIV? What resources are available to help us as trans people in Tennessee avoid getting HIV? Next, I'm going to talk a little bit about how to get PrEP, PEP, and free condoms across the state. First, what is PrEP? PrEP, which stands for pre-exposure prophylaxis, is a daily pill which reduces your chance of contracting HIV through sex by 99% and 74 to 84% when sharing needles. PrEP is for anyone who's vulnerable to HIV through sex or sharing needles. If you'd like to learn more about PrEP and trans folks and the ways that it impacts trans bodies, you can join us on Wednesday, November 18th at 6 p.m. Central, 7 p.m. Eastern for the final video of this week. There is also PEP, which stands for post-exposure prophylaxis, and is an emergency medication taken by individuals who may have been recently exposed to HIV in order to avoid contracting the virus. PEP is only taken in emergencies, and you must take it within 72 hours of the potential exposure. Finally, condoms. I know that you know what they are, but you do know that you can protect you not just from HIV, but also a slew of sexually transmitted infections, as well as unplanned pregnancy. Together, these 3 options come together to make a really powerful sexual health toolkit. Next, we're going to talk about how to get PrEP and PEP in your community. We made it easy for you with a website, www.getpreptn.com, where you can find more information about both prevention methods, as well as a really nifty interactive map to find a PrEP navigator or provider near you. So I just said PrEP Navigator. What is a PrEP Navigator? We know that PrEP figuring out how to get PrEP and how to use PrEP can be really overwhelming and tricky to navigate. So PrEP Navigators are these awesome folks who can help to support you in learning more about PrEP and answer any questions or concerns you may have. They can help you find a prescriber, help with insurance, help you navigate the various programs that might be available to you in order to cover the costs of PrEP. Navigators help to follow up once you are on PrEP to help address any continued concerns you have, and they can continue to follow you for as long as you need. Prescribers are healthcare professionals who can prescribe you for the pill for PrEP, and this is the only way to access PrEP. We know that finding a PrEP provider can be really overwhelming and tricky to navigate. So we have this really awesome website. If you go next slide, please, Jack. GetPrepTennessee.com. And here you can find both navigators and prescribers. PrEP navigators can help you to support learning more, answer all your questions, and then help you find a prescriber, help with your insurance, help you navigate the various programs. And here on GetPrepTN.com, you can search for those prescribers, search for the navigators, and look at different community health resources that we have to help guide you as you explore your options related to PrEP and PEP. Like I said, we have this really nifty map, so you can put in your zip code and it will show you all the different providers near you. Once you find a provider near you, you can reach out to them and set up an appointment. Your healthcare provider will discuss with you your sexual health practices, the protection you use, and your medical history to help you decide if PrEP is right for you. Again, if you need help navigating this process, a navigator can help you, and GetPrepTN.com can help you find those navigators. If you're in need of PEP, so post-exposure prophylaxis, the emergency medication taken by individuals who may have been recently exposed to HIV, you can immediately access it at your closest Planned Parenthood, CVS Minute Clinic, Walgreens Minute Clinic, or a nearby ER. PrEP navigators can also help you explore options related to PEP and help make PrEP and PEP more affordable to you. Next, please. So condoms. This interactive map brought to you by Planned Parenthood shows you where you can find free condoms and other safer sex supplies near you. Whether you're at a bar, a community center, barbershop, or a tattoo parlor, all you have to do is show up and take what you need. So you can check out this website for that map, and there's lots of other good information about condoms on the website as well. Don't forget to join us again on Wednesday for our last webcast of the week, which will focus on PrEP, give you the facts on how it works for trans folks and dispel some myths, and finally discuss why we should all be aware of it, either for ourselves or for our trans siblings and others. And that's it for today. We're planning some short videos on trans health topics. So if you have any ideas, please go to the website and let us know what you'd like to see next. Thanks for listening, and don't forget to stick around the live Q&A session, which starts now. The link to join the Q&A is in the description box below this video.